We're at the clinic with Dr. Mike, learning about gastric ulcers. At the clinic with Dr. Mike, University of Georgia. We've talked about so many diseases and illness and ailments with horses. Today we're going to talk about one of the most prevalent ailments with horses that there is. That is ulcers. Dr. Mike, how prevalent is ulcers in horses?
Well, Alan, I'm glad you asked that. I would be willing to bet most horses that are shown, if you got 10 horses you're showing, 7 of them's got gastric ulcers.
Well, is it strictly to performance horses?
No, it can be anywhere from that brood mare that's being shipped to a new breeding farm or that foal that's on her side. But obviously it's most common in show horses or race horses because they're in a stressful environment.
Well, that being said, what are ulcers?
Well, basically what happens is the stomach produces too much acid, just like it does in a person. And the lining of that stomach is eroded away and it becomes painful. And as you can ask anybody that has ulcers, when you eat, you get abdominal cramps. Well, in horses, colic is one of our #1 signs we see. And these horses just don't want to perform. They want to cramp up a little bit in their belly. They're not being their normal self. So those horses are quite frequently pulled out in scope and seen to have gastric ulcers.
And now we see it a lot at the rodeos with some of our rope horses and some of the barrel horses. When it comes time to perform, sometimes they may act like they don't want to. And one of the things we look to is the fact that they have ulcers. How bad can ulcers get into the performance of the horse?
Well, an ulcer will stop a horse from running. If your belly hurts bad enough and you're producing all that acid, you're going to have such abdominal pain, that horse is not going to get out there and run and stretch out like they need to. And you've got to do something if you're going to remain competitive. If not, you're not going to be in the money for long.
And now, when we talk about the performance horses and how prevalent this is in the equine world, we talked about foals just a moment ago off camera. And there's a lot of things that folks read to where babies are born with the ulcers, but that's not the fact. They can just get them quick with that stress. Talk about the babies.
Well, the baby's not born with ulcers. I mean, being inside mom's the best environment there is, but it's when you hit the ground that all these things start happening to you. And if you're being shipped off to get bred back on foal heat, all these things, babies are very susceptible to developing gastric ulcers. And one of the common things you'll see in these foals is they'll be laying down and they'll roll up on their back and just kind of roll on their back and stay there. And what they're trying to do is take pressure off of that stomach because that stomach is hurting. And they don't nurse. That's the other thing you look for. They quit nursing. You look in there, mama's got this big udder. These babies are not nursing because it's hurting their stomach to put food in there.
Now, I'm going to come back to the babies in just a moment, but first I want to ask you, what kind of treatments do we have for the older horses with ulcers?
Well, the best thing we got out there is a drug called omeprazole, and it's made by Rodeo. All of us are going to know it by GastroGuard. That's it right there. And they've got a preventative one on the market too, but it is the only one that's been shown to work. Now, sometimes you'll see people trying to sell some of these compounded products off the market. It's not going to work. There's a reason this product's out there and it's done a great job, and it will put this horse back in the money, but you've got to treat it for the 28 days that the horse needs to be treated for.
And a lot of times we don't notice the ulcers until it shows up with our performance horses and the fact that they're not going to run and perform like that. You talked about the preventative. Would we be ahead of ourselves, or would we be in line to go ahead and start treating all of our babies for ulcers?
You bet. If I'm going for the big money, I'm going to put that horse on UlcerGuard, which is again a product that's going to try to prevent these ulcers and get in there and make it my horse the best chance. And I always tell the students, set yourself up for success. And I think it's the same thing when you're showing your horse. Set yourself up for success. Prevent those ulcers before they ever get there. It's going to be more economical and give that horse the best performance it can.
Success in health maintenance is going to make success in the show ring or at the rodeo. That's it for At the Clinic.